like that. We'll call this meeting of the Craven County Board of Commissioners regular session for Monday, February the 15th to order. Madam Clerk, if you will, please call the roll.
Commissioner Smith?
Here.
Commissioner Liner?
Here.
Commissioner Mark? Commissioner McCabe?
Here.
Commissioner Mitchell? Here. Vice Chairman Booker?
Here.
Chairman Jones?
Here. If you will, please let's stand together as we salute and pledge to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Blessed are those whose strength is in you, O God, whose hearts are set on a pilgrimage. Speak into the innermost chambers of our hearts, God, and into the heart of these chambers. Bless our pilgrimage as we labor to preserve democracy, uphold liberty, and serve the American people faithfully. Grant us the insight of your wisdom and the shield of your truth and righteousness. Strengthen our resolve to serve responsibly in the courts of your kingdom. Strengthen our will that our service to you will not falter. Strengthen our hearts that we will show forbearance to each other. Remind us then that our strength is found only in you, and may we go from strength to strength as your people, as a country, and as a county. We offer this prayer to you in your strong and holy name. Amen.
Amen. Commissioners, before you have your agenda. Are there any items that you desire to add or remove from today's agenda? Hearing none, do I have a motion to accept the agenda?
So moved.
Second.
I have a motion and a second. Any further discussion on the motion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed? Motion passed. Next will be the consent agenda. Are there any items to pull from the consent agenda? Hearing none, under consent agenda this morning, you have the minutes of the February 1st regular session, tax releases and refunds, a budget amendment for DSS, and a budget amendment for a donation for the Sheriff's Department. Do I have a motion?
So moved.
Second.
We have a motion and a second. Any further discussion? Hearing none, Madam Clerk, if you will, please call the roll.
Commissioner Smith?
Yes.
Commissioner Liner?
Yes.
Commissioner McCabe?
Yes.
Commissioner Mitchell?
Yes.
Vice Chairman Booker?
Yes.
Chairman Jones?
Yes. Thank you. Next, we have with us this morning Mr. Stuart Hill, who is representing Thompson, Price, Scott, and Adams, who will give us the presentation of the 2020 Annual Audit Report. And you should have that audit report there for you in front of your desk. Good morning, sir.
Good morning.
Welcome.
Thank you for letting us be here this morning. We appreciate it.
Yes, sir.
Appreciate it. Also, thank you for allowing us to do your June 30, 2020 audit report. So we appreciate that greatly. So you should have a presentation summary for the audit report that looks like this, and you should have a full audit report that looks like this. So we're going to go with this one because we don't want to be here all day. So with that, we will go into it. And first of all, let me say that I'm substituting for Alan Thompson today. He had some other things come along, but at any rate, I'm pleased to be here. With that, we'll go into the presentation. If we can go to the next screen. Basically, the first items are going to be some general comments, followed by some required communications to governance, and the audit results, and any questions or comments. So that's our agenda here. It won't take very long. And feel free to ask any questions along the way. If I know the answers, I'll answer it. If I don't, and Craig does, maybe he'll help. If not, we'll get you an answer between us. So don't hesitate to stop me. Next slide. Okay. Basically, this is some of the general comments. The types of opinions you could get on an audit report. Could be an adverse one, which is one you don't want. We could disclaim it to say that, look, this is a mess so much that we can't tell what it's, so you don't want that one either. A qualified or modified opinion would be one that there was some significant and material things that needed to be adjusted, but all in all, it would still be, not as bad as the adverse or the disclaimer. The unmodified is the one you want, and it's the one you got. It's a clean audit report, and
He's on the next one.
that's the one you would want to have. So the next items is, if you go to the next screen,
Go one more screen, please. There you
There
go.
we go.
this is the letter of to governance. This is the required communication. I'll briefly go through the key things on that. We don't. I mean, you can read it anytime you want, but I'm gonna just say basically it just says that how the audit went from our perspective. Your accounting practices and procedures have been properly applied. We didn't have any difficulties with the staff or the information. Craig and his staff provided the information and the availability to answer questions promptly for us. We didn't have any material misstatements, no disagreements or issues with the management. And basically, go to the next screen, please. Next slide. Okay. That's all what's going on right there in this letter. And then go on to the next slide. Okay. So sometimes there's cases where you have consultation with other auditors other than the representation from the predecessor auditor. I'm not aware of any of that. So basically, that's the only other auditors that we, had correspondence with, and that was to get the representation from the previous auditor. And then next slide talks about the other auditing findings and issues. In the compliance section, which I believe starts on about page 172 in the full audit report, we had some suggestions. Basically, is what it is, but it's some findings that we have to put in there. But those were all in the Medicaid type section, and it all had to do with the documentation. To our knowledge, there was no real cost. No question cost on it. It's just the documentation being cleaned up a little bit. And that is typical with almost all counties. They're going to have some of that. It's kind of like, I use it like typos. There's going to be a typo somewhere, and I promise you in this audit report, we do the best we can, but there might be a typo in there somewhere. We go through it and go through it and go through it, but if you look hard enough, I'm sure you can find one. And so that's kind of what I correspond that to. I don't want to make light of it. We did make some suggestions as to how to minimize that, and that's already been communicated and addressed. I just wanted you to be aware that is in there. That's where we are on that. Next slide. Let's go on to the next one as well. That's just general verbiage. And next slide. Okay. So now we're going to get into the meat of your audit report, some numbers and stuff. Go to the next slide. So you see we're using a 5-year trend, so you can see any kind of trends going on through this 5-year period. We're not going to read all these numbers. This slide and the next 2 slides are numbers that came right out of the audit report, and this gives us the basis for the charts that are coming up. So if we can go to the next slide, and then the next slide, and then one more. This is what we're going to, all these charts are going to be generated by the 3 pages of all that 5 columns of data, which as I already said, came straight out of the audit report. So if this first chart that you see is an analysis of your fund balance for the general fund, the blue bars represents your total fund balance, the red bars your available fund balance, and the green bars your unassigned fund balance. Your total fund balance is like the difference between your assets and liabilities. Basically, that's a real crude, short way of saying it, but it's kind of your net of assets versus liabilities, pretty much. So your total fund balance in 2020 is about $39 million compared to about $33 million in 2016. Your available fund balance in 2020 is about $26.8 million compared to $24.4 million in 2016. And the unassigned fund balance is about $25.4 million in 2020 compared to $24.3 million in 2016. Your available fund balance is the total fund balance less any prepaid items and any state restricted items. The unassigned fund balance is the total fund balance minus those same prepaids and the restricted from state and anything that you guys have already assigned or committed to some specific category. So the unassigned fund balance is what is left over to be used at your discretions. Next slide, please. This is an analysis of your fund balance available and unassigned as a percentage of your general fund expenditures. The available is represented by the blue line, and the unassigned is represented by the red, and those are the percentages, again, of the general fund expenditures. And you can see the trend, how it has gone through this time. Your available fund balance 25.38% in 2020, and the unassigned is 24% in 2020. Next slide. This is collection percentages for your taxes, and we have a comparison of Craven County, which is the blue line, and the red line represents counties, other counties in the state with population of 100,000 or more. I think you guys have probably 102,000 or something like that population, so that's the category you're compared with. So you can see how your percentages compare with the other counties. And then the other grayish looking line is the statewide average of other counties regardless of their population category. Next slide. This slide represents your total property values and your total levy amounts. The first one being the property values in the red. Your property values were $10 billion in 2016, and in 2020 it was $9.6 billion. And the actual levies in 2016 was $46.9 million, and in 2020 is $52.8 million. Next slide. This is a breakdown of your general fund revenues by various categories, so that you can see, where the largest revenues are coming from. And your ad valorem taxes is the largest at 46.12%. The second largest is intergovernmental revenues at 21.79%. That's typically your franchise taxes and ABC beer and wine taxes and stuff like that distributed from the state. And then third is the sales tax, which is the local option sales tax that's distributed back from the state to the county at 16.54%. And then the others are the smaller ones you see there. Next slide. This also shows the revenues by those same categories, but it has the dollar amounts rather than the percentages. So you can see that in 2020, your ad valorem taxes, for example, was 53 million. Your sales tax was 19 million, and the intergovernmental was 25 million. Next slide. This chart represents, similar to the revenues, the expenditures and where the money is going to for the general fund. And in this category, you can see that your largest category is education at 26.76% of your general fund expenses, followed by social services at 18.11%. And then third was the public safety at 17.81%. Next slide. And again, we got the amounts for those as well. So you can see in 2020, your education was 28 million. Your public safety was 19 million, and the social services was 18.8 million. Next slide, please. This slide, just when we talked about the general fund balance a minute ago, I think I already went through that. I got ahead of myself, but basically that tells you what the assigned and the unassigned and the restricted and how that goes, how that is calculated. Next slide, please. Okay, so as I said in the beginning, you got the unmodified opinion on all major and federal and state programs, and just to wrap it up, that's a good opinion. That's what you strive for. Your staff did a great job. The records were in good shape. You're lucky to have that, because we have some that are good like y'all are. We have some that's not nearly there. So. And again, it was a pleasure to work with Craig and the staff, and we appreciate that opportunity. And with that, if you have any questions, otherwise, I'm through.
All right, questions from the board? Commissioner Liner.
Sure. Would you mind going over on the back page, the federal award findings? Are those three the ones that you were talking about that relates to typo errors and stuff?
Yes, sir. Absolutely.
Thank you, sir.
Yes, sir.
Craig, do you have anything that you want to add?
No, sir.
Jack?
Yes, sir. I never pass up an opportunity. I agree with Mr. Hill. Craig, thank you for all your hard work and your team's hard work, and thank you. It's our first year with our new audit firm, and I think they did a great job. Really enjoyed working with them. Mr. Merritt's here if you have any questions, because the programs he's talking about typically fall under social services, where you have that last page. So if you have any questions of Mr. Merritt, he's here to help you. But other than that, thank you, sir, for your time this morning.
We appreciate it.
If I could, Jack brought up a point that just refreshed my mind. Last year, we had a findings that cost us some dollars because of the errors and the.
Right.
Do we have any this year?
No, sir.
No
As he
dollar.
indicated, there was
no dollar loss at all.
no cost. It was more clerical.
Okay.
And just for your information, Board, we received a letter last week, the county manager and myself and DSS director from the state, and it gave in reference to last year's findings. And the letter that we received said that the review of the county's response and evidence of corrective actions for the identified findings determined that required actions were satisfied. So everything from last year, the findings in the audit have now been, the state says they're good, proceed on. So I thought that was good. It was very timely. So, okay, thank you again. Please relay to all your fellow workers and everybody that we appreciate their help and assistance.
I certainly will, and we certainly, again, we appreciate the opportunity.
Yes, sir. Thank you.
Y'all have a blessed day.
Same to you. All right. Next is the Trillium Health Medicaid Transformation Report. Good morning, sir. Mr. Peterson, come right on up.
All right, thank you for having me. Let's stand up here. Yeah.
Yes, sir.
Right in front of you all, okay. Well, can I take the mask off?
Yes, sir, please do.
Okay, thank you. Thank you for having me, and I appreciate you inviting me here today. This is a little bit different than previous years. For the past 7 years, I've been out here just giving you an annual update. But Commissioner Liner, who's on our Regional Advisory Board, asked me to go through this presentation with you about this Medicaid transformation that's happening across the state. And I'll be going into great detail with that. I want to thank him for being on our board, and also Ms. Sheets, who's an attorney in town here in New Bern, who also serves on our regional board. So next slide. So, yes, okay. So we've been under a fee-for-service model, not necessarily Trillium, but the state has in the physical side. And Trillium Health Resources has been on we've been on the managed care side for several years now, about 7 years. And so they're moving that, the General Assembly has moved that to the entire state going on a managed care model. And the purpose of that is to get integrated health care along with mental health care into one system. Next slide, please. So in 2018, they transferred this from a fee-for-service to managed care. And like I said, we've been already doing this. And this combines your behavioral health, your physical health, and your pharmacy benefits. And I'm going to go into a lot more detail about that when in further slides. Next slide. So you'll hear terms, and I recall in 2018 going across all my counties and talking about the standard plan and the tailored plan. And so the standard plan is the insurance companies that are going to be managing the low to moderate risk individuals in Medicaid. Okay? The tailored plan, which is going to be Trillium, are going to be managing the high risk individuals like we do today for the people with developmental disabilities, substance abuse, and behavioral health. There's another bullet in here that I think all counties need to be aware of, and I know the DSSs are very aware of this, but there's a specialized plan for children in foster care that the state is in the process of developing right now, okay? And that might or might not fall under us, okay? Next slide, please. So, like I said, the standard plans will cover the low to moderate risk, and there will be 5 insurance companies that do that. And I will tell you who those 5 are in the next slide. But the Taylor plan, we will be managing high-risk individuals on a per member per month, the PMPM. And one example that I always give of that is right now we manage all the low, medium, and high-risk individuals, and we get paid by the state a per member per month to manage all the low-cost to high-cost individuals. So, and I'll just throw a number out there. Let's just say the state gives us $50 per member per month for the low to the high risk, okay, to the low to the high cost. Well, when we move to just being a tailored plan and only managing the high cost, high risk individuals, our per member per month is going to go up.
Makes sense.
Okay, great. On that also, we've only been managing the mental health, developmental disabilities, and substance abuse services for an individual. When we move to a tailored plan, we're also going to be managing their physical health. All right? All of their primary care docs, all of their medications, and I'll go into a little bit more detail about that. Next slide, standard plans. Let me talk about that. You can go to the next slide. So these are going to be commercial insurance companies that are doing this, and about 2 years ago, the state put out an RFP for insurance companies to apply to become standard plans to manage the behavioral health Medicaid individuals that we currently do today. All right? So in that, they awarded in February of 2019, AmeriHealth, Blue Cross, United, WellCare, and Carolina Complete Health the awards of managing the low to moderate risk individuals. Next slide. This is the map that the state has, which you'll see a little bit later is different than our map as a managed care organization. These are the maps for the private insurance companies and the regions. And in the previous slide, there was one Carolina Complete Health. They will be managing regions 3, 4, and 5, but the rest of them, AmeriHealth, Blue Cross, United Healthcare, and WellCare, they're going to be managing the entire state. Okay? So there's going to be overlaps of covered insurance companies. All right. Next slide. So the enrollment process is coming up. So there's going to be mandatory enrollment of Medicaid beneficiaries. And just to give you a number, those in our budget today and the number of people that we serve today, about 70 to 80% of those individuals are low to moderate risk. So the reason why I wanted to go in detail in this presentation, July 1, those individuals will no longer be served by Trillium. We currently have been serving them for years and years and years. They will no longer be served by Trillium. They will be served by those insurance companies. Okay?
So make sure I understand you. The low to moderate individuals will move from y'all to the insurance plans
Yes.
come 1 July.
Correct.
And y'all will retain your high risk, but it will be mental, behavioral, and physical.
Well, so there's a time lapse difference. Our plan, and I'll go into detail about that, doesn't start until July 2022. But we will continue to be serving those high risks like we are today, but not necessarily the entire physical health side that you added at the end there. Okay? They'll still be continuing to get that physical health like they do today until 2022.
But okay, well, this is real confusing.
Yes, yeah.
Okay, so for that gap, that 2-year gap, for the high-risk individuals, who's doing their physical health?
Who they are serving today. So whoever the insurance company that individual is doing. So there's a fee for service that someone's on Medicaid and they go to their primary care doctor. Medicaid fee for service will pay for that.
All right, so let's pretend I am a high-risk individual.
Yep.
1 July, you are going to be doing my mental and behavioral.
Like we do today.
Like you do today.
Yep.
Okay. And from 1 July 2020 to 1 July 2022, my old doctor
Yes.
is going to be doing my physical health.
Thank you. Yes,
Okay.
exactly. Yep. Okay. So,
I have a question.
yep.
How does it affect the individual? Does it make any difference to the person that's being served?
Yes, it will, and that's one of the things that we want to make sure that people are aware of. With those 5 insurance companies, most of them are national companies, and they cover the entire state.
Right.
But you don't know whether your primary care doctor has all 5 of those insurance plans with Medicaid, And so for every individual, we encourage them to go to their primary care doctor and say, you know, do you have, and I don't want to preface which one, any one of those 5, and say, do you have that insurance coverage? Oh, good, I get to stay with you as a
Now,
primary
is
care
there
doctor.
anyone to coach or to train these individuals? Because if we're having some problem understanding it, the
Yep.
people receiving service are going to have difficulties as well.
Yeah, there's 2 parts to that. The state is setting up enrollment brokers, okay, so that they can help an individual. They can't tell the individual, oh, you need to go to this plan because it's better for you, but they can give them all 5 plans and help them choose for themselves. And then there's an ombudsman program that if the individual isn't liking their plan, they can also get support from the ombudsman program. So the state is setting those up, and I'll go into the time frame of those too, okay? So we're encouraging folks to contact their doctor's office and ask which plans they're covered by. Next slide, please. So for the standard plan, this is what you were getting at, all right? March 15th, there will be an open enrollment for individuals that are low to moderate risk Medicaid to choose one of those 5 plans. Okay? That ends May 14th, so they have 2 months to choose. If they don't choose, then there's going to be an auto enrollment process. So let's just say Dave doesn't know and doesn't choose, then I may get auto assigned to Blue Cross, and then patient B may get assigned to AmeriHealth. Patient C get assigned, so they'll do an auto enrollment in that process. Okay, and that auto enrollment starts May 15th. The standard plans, those 5 insurance companies, are continually, and we've talked with quite a few of our current providers that we have contracts with, because we have about 500 providers that we contract to do mental health services. The standard plans are continuing to work to contract with all of those folks. Okay. Next slide, please. All right, next slide. Yes. So our time frame for us, okay, I just talked about standard plans. Now we, as an LME MCO, local management entity managed care organization, here's our timeline. The difference was ours was an RFA, okay, not an RFP, a request for application. That was posted on 11/13. On February 2nd, we delivered, actually we did it on February 1st, just to save one day, which was a Monday. We delivered 20 boxes of our application to the state, okay? Thousands and thousands of pages. Just to tell you how concerned we were for making sure it was going to get there was I was the backup driver if that person had a flat tire coming in from Greenville to bring it into Raleigh. And so we wanted to make sure it got there, and it did. So it was put in on February 1st, but they were due February 2nd. The state is going to decide on June 11th which contracts are going to be awarded. Currently today, there's 7 of us, 7 Trilliums across the state, okay? In legislation, they said they can pick 5, they can pick 6, or they can pick 7. If they pick 7, we keep the same 26 counties that we currently have today for overseeing all the mental health, developmental disabilities, and substance abuse services. If they choose 6, then those are what they're calling empty counties, and those counties will need to get divided up amongst the other 6 managed care organizations. All right? I will say we're one of the best managed care organizations in the state. I am not afraid of not getting it at all right? With that being said, the legislation does give that leeway, though. And I will say, during the standard plan process, there was a very large national insurance company that did not get approved, okay, that had applied to become a standard plan. So they're making sure that they're taking a close look at these applications. In the winter, they're going to do a readiness review of the tailored plans, and then July 2022, we implement the tailored plan. Next slide, please. This is the current map today of the 7 regions, okay? And you'll see we have the most counties. We have 26 counties. And so we're very familiar with how to manage multiple counties and doing presentations like this in all 26 of our counties. Next slide, please. So I'm going to hit on, tailored plans being managed by LME MCOs. We will be managing the most severe behavioral health, substance use, and intellectual and developmental disabilities. We'll also be integrating behavioral health with physical health and pharmacy benefits, and I'm going to talk a little bit about that. Tailored plan care management is going to be part of us, and social determinants of health. All right, next slide, please. So with this RFA that the state did, it is for 4 years. If we get awarded it in June and we start it July 2022, it's good for 4 years after that. All right? And only the LME MCOs can apply for that this time. And so all 7 managed care organizations that I was talked about did apply. All right? So only us could apply. I will say in legislation, in 2026, it opens up. And what I mean by that, we may not be the only ones applying for it. It could be that we could be included with insurance companies to apply to manage these individuals. Okay? And that's a new application coming out in 2025 and 2026. Next slide, please. We want to make sure that we're providing community-based care, which we think is really crucial, and you all know a lot of the providers that we have here in Craven County. We're going to be managing the whole person, including the physical health, the BH, which is behavioral health, the intellectual and developmental disabilities, the TBI, which is traumatic brain injury, the long-term services and supports, LTSS, okay, along with the pharmacy and unmet related needs. Next slide, please. This hits on the social determinants of health. We want to make sure that we're addressing the 5 biggest that are common out there: transportation, housing, food, employment, and personal safety. And we all know if those aren't met, our cost of both physical and behavioral health go up. So we're working on trying to develop those. Next slide, please. So currently today we have one call center. Well, we're going to have to expand our call centers. In our contract with the state, that if we become a tailored plan, and we will have to have a pharmacy call center. We have about 2,100 pharmacies in our 26 counties. So we're going to have a separate call center for just the pharmacies. Okay? We're going to have a provider call center. And so when we talk about providers, right now we have 500 and we manage that fine. But if we're now talking about having physical health providers, like yours and my primary care doctors that serve Medicaid, our call center is going to expand enormously for providers. We're going to have a nurse line. because we now need to make sure that we're handling all the physical side of that house. And then what we have today is our current call center. Next slide. So this department did establish criteria, and it's a very comprehensive and thorough criteria. I will say we were able to look at the applications that all those 5 private insurance companies submitted, and theirs ranged between 4,000 to 6,000 pages, their application. Ours was very, very close to that, okay? Because that's what the state had asked for. I'll just say the RFA that came to us from the state was 1,008 pages, okay? And we had to respond to that. They'll be evaluating that, and they'll take a close look at our qualifications. And if you take a look at who our executive team is, our CEO used to be the state director of the Division of Mental Health, Developmental Disabilities, and Substance Abuse. So there's a lot of years of experience within our executive team. Next slide, please. So what stays the same? So eligibility rules will stay the same for services. We'll say, you know, we have to make sure that they meet medical necessity from a clinician. Our services that we currently do today will stay the same. The difference that might come about this is right now, I'll give one example. For someone that just needs basic outpatient therapy once a month, we do 24 unauthorized visits. So you don't have to call us to say, Dave needs some outpatient therapy. They can just go ahead and do that and bill it because it's a fairly cheap service in the sense of costs. The insurance companies, we hope, will model after that, but they may do a different, instead of 24, they may do 20 visits unauthorized, that type of thing. If there are any right now, the co-pays should stay the same. And our local DSSs are still responsible for reporting any changes in their enrollment to receive Medicaid, and they're very aware of that. Okay. Next slide. On the state website, they have these 6 bullets that you can go into. You can find how to choose your plan, benefits and services, finding a provider, compare the plans, tip sheets. You can enroll, like I talked about March 15th, in a variety of ways. So they're trying to make that as open as possible. Next slide. Some of the things that you may hear about, and this is, I wanted to make sure that folks were aware of this. Right now, we have providers that are in your schools doing behavioral health therapy for kids. Okay? We pay them. Most of those kids who are just getting outpatient therapy may be moving over to the standard plan and not covered by Trillium. All right? So hopefully with that conversation, the schools can have that conversation with the insurance companies and allow hopefully the same providers to come in and do school-based therapy. Okay? Mobile crisis management. There's a state rate for that, but as you all know better than anybody, the 26 counties that we cover are very, very, very rural. So we have to pay a higher rate than someone that does mobile crisis in Raleigh, because they may travel 10 minutes to their mobile crisis when our folks have to travel an hour. All right. Our call centers are going to be changing, like I showed in the previous slide, and provider contracts are going to expand enormously. Next slide. So this is the slide that I usually do every year with you all, just giving Craven County specific information. And so last year we served 4,588 individuals. 3,402 of them were mental health, 1,004 were substance use, and 469 were intellectual and developmental disabilities. And those numbers will never add up because a lot of those individuals have dually diagnosis. So, next slide. These are those links I was referring to. If you're interested in those on the state website, please take a look at those. And last slide is just any additional questions.
All right, questions from the board? Commissioner Liner, you want to?
Yes, sir. Dave, I want to thank you. I mean, everybody understands how clear this is. It's as clear as that sun that's out there shining right now this morning. Dave went over it very briefly and everything else. I mean, there's a lot more to it. I mean, as far as our part, CARTS is going to be a big issue. CARTS is going to take a heavy hit on this if they are unable to contract with the providers. You know what they tried to do to us last year when we were moving in? If you remember, on the board last year, this was already approved last year. Then the state pulled the budget. We already had people signed up into the system. State pulled it all out. That's confusing to the people because we're trying to get the word out to them. They signed up, but now they're not signed up, so they got to sign up again. Pharmacy is something completely new to Dave and his group that they're trying to get coming aboard. I mean, all of us has been out there in the system. Most of the providers in this area have cut off Medicaid. It's taken so long to get paid for Medicaid and to get their money. You've got a number of providers out there, quite a few, that's no longer taking Medicaid patients. And that's scary. And it's the same way I feel it's going to be. And Dave and I have had this conversation as far as the pharmacy. This is all new to Dave and his group as far as having to provide the pharmacy service for all of these people and everything else. So I felt that this board needs to be aware of what's coming down because this is you're going to start getting phone calls this summer when this starts taking effect in places and everything in there. Because I think a lot of our people, and DSS is on top of this and on board and knows what's going on.
Yep.
But this is changing. I mean, hell, it's changed 4 times I know of since last year and going through it. So, Dave, I appreciate you coming down and spending the time. But
you're welcome.
Dave's available for anybody that wants to talk with him. But I think it's critical for our people so we're not left behind. Like David said, we're rural, and the 5,000 people out here, and I don't want to sound negative or anything else, need the help and not going to know what they need.
And on your point, Commissioner, anybody can give me a call because I can go into a lot more detail. And this was a broad overview, but I'd be happy to meet with you individually or as a group. So,
Vice Chair Bucher.
2 things. Number one, I assume this is all being driven by the state Department of Social Services. They're the ones.
The Department of Health and Human Services.
Health and Human Services.
Yes.
Yeah, excuse me.
Yep.
So they're the ones that are the architects and saying, we're going to change everything and this is where we're going.
Yes, and yes.
Okay. The second was just more of a curiosity. 6 or 8 slides back, you showed us a slide that showed the 5 critical things that people need. And transportation, housing, food, employment, personal safety. I assume that's not in any order of importance.
No.
Because transportation would not be number 1.
Right.
Would be food and housing, I would think, would be 1 and 2. It just struck me. Why?
Yeah. No, that was not in any order.
Okay.
Correct.
Okay.
Correct. Yes.
Both of our lady commissioners wanted to go. Commissioner, whichever which one you want to go first.
Well, Vice Chairman Booker spoke to part of what question I was going to ask. And the other part was, now it's driven by the state. Where are the monies coming from?
So the Medicaid dollars are federal dollars. Okay, and that's the largest part of our budget. It's about 85% of our budget. So, like I said, when the individuals that are receiving low to moderate services, a part of our current budget today is going to move to those 5 insurance companies.
Now, you also mentioned that the school was part of it. You have people that you have in the school? Or do you use?
We have provider agencies that do school-based therapy, yes. Yes.
All right,
And
Commissioner.
Dr. Doyle's well aware of this, and she's been using it. Well, you know, Ms. B.
Well, can I just ask for Commissioner Mitchell?
Yes, sir, you go.
That was one thing I wanted to ask. Now that you're going to 5 or multiple providers, I mean, are they going to take and have, if a child, one's got insurance with this company, another's got insurance with this company, I mean, are they going to have multiple agencies coming into the school to do one-on-one, or?
We hope not. What we are thinking is that individual agency is being covered by all 5 of those insurance companies, so that then you don't have to have 5 different companies coming into the school or throughout your community even, you know.
Thank you for the explanation. All right, Commissioner Mitchell.
2 questions, and thank you. One, I want to confirm, is it DSS who is responsible for letting the individuals who fall under the low, medium, high-risk plans know about this system? Who is responsible for getting the information to the people who are going to be impacted by this very complicated system?
Yeah. First and foremost, it's the state, okay, the state DHHS, and then we as ARMS will try to make sure that we're getting out as much information as possible, like having meetings like this. And we've been doing this on our website and in public forums for about a year now.
Okay, and my second question is, this is a complicated system. People who need it the most are going to have the most trouble navigating it. So I'm going to establish a category I'm going to call people falling through the cracks. Okay. What are you going to do? What is someone going to do about the people who fall through the cracks? Okay, I understand the auto enrollment, but then there's also I didn't know I was supposed to do this, and I need to see a doctor, a therapist, a primary care now. Right. What do you do about those people?
Yeah, and that's a really good question. And I have heard the Assistant Secretary at the state answer that directly, as if when that switch comes on July 1, nobody should be denied services. And I think he gave a time frame, okay, so that if there was potentially a mishap in whether they're under standard plan or tailored plan, then they would still be covered and be able to see their doctor or physician or whoever.
So to make sure I understand what you're saying, during this bubble of time, let's say 3 months, while everything gets sorted out, you go on and see your doctor, Mr. or Mrs. Smith, and we'll sort out the issue meanwhile.
That's what we're hearing, yes.
Okay, but we don't know, that's what we hear, but we haven't seen it in action.
Well, right, because we won't see it in action until July 1, but currently, like today, those low to moderate risk individuals are covered by us. We get the funding for that today. July 1, those 5 insurance companies will be getting the funding to do that, all right, to start paying for those services. I would just, and on your note, I would just encourage everybody to be asking their primary care doc which insurance plans they cover.
And sign up for that one, preferably.
Yeah, if you want to stay with your primary care one, yes,
Right.
yes. Well, I shouldn't say that. I don't want to do any advising.
Okay.
All right.
Any other questions? All right, staff have anything? All right, if not, Mr. Peterson, thank you for taking your time to come.
Yeah.
Thank you all. Appreciate it.
Appreciate your leadership and what you do.
Thank you very much, Commissioner.
All right, next on our agenda is the Health Department. Mr. Scott Harrelson, good morning, sir.
Good morning.
Hope you're doing well today.
Yes, sir. Good morning.
Scott, if you will, this morning, we have two items that we're to vote on, but also, if you will, take a little time and give us an update, after you finish on our current status of COVID here in Craven County.
Yes, sir, I'll be glad to. The two items we have today are funding for the COVID effort. The first is emergency preparedness, and the second is communicable disease. But to us, it's a little more seamless than that because it's all going towards the same efforts. And the first pot of money is $46,617. And the efforts that are going on now, it's really all facets because we have testing. We had 2 days of testing at one time, drive-through at the health department, then we dropped to 1 day, and then we have an outside source that was a subcontractor with the state that's doing testing at Without Limits Christian Center. Pastor Pat we were able to work with them because they have an overhang over there, and now from about 10 to 2 every Monday of the month, for the next, for February or March, they're hosting that for us, which is a big help. And in addition to that, we have a call center that's 5 days a week. We have the Convention Center Mass Clinic, which is 4 days a week, and beginning this week, they're getting busier and busier because we have higher second dose numbers coming in on us, and we have 700 first doses every week as well. In addition to this, our communicable disease staff is working outbreak clusters. We had 5 go on this past week. They were working 5 outbreak clusters at one time. And then there's the testing that we still provide through our clinic set up there. And we're working with CCHC and Carolina East as well. And we'll be submitting an application for a special event to try to get more vaccine into the community, doing outreach efforts, trying to get people who otherwise have problems of navigating the system, trying to get in and get appointments. So a lot of COVID activity going on right now. And as I said, we're hiring additional staff. We have contract staff that we've hired. We've got staff that have been repurposed from the state. We have staff from other county departments coming and helping us in the call center. We have, it's difficult to find nurses, so we're working with emergency management with Mr. Stanley and Ira, and Ira was able to reach out to some local paramedics, and they're really good assistants at the convention center giving the shots. So we have one. I think we've got a second one coming on board. ECU School of Nursing. They need hours, so we're getting student nurses to come over and give shots as well during the clinic. So great resources there. And also just supplies. It's hard to find gloves. Sometimes we get 1.5-inch needles. We'd rather use 1-inch needles. We're trying to find those for the mass clinics. Just supplies, people, and hopefully more vaccines soon. The state tells us that there'll be about 16% more coming in the short run. And now we've also got some of the private pharmacies that are offering the shot. But we're not competing with them for stock. I think what they had was some that was not used in the long-term care center rest home efforts. So the first pot of money is $46,617.
All right, do I have a motion?
Make a motion.
Second.
I have a motion and a second. Any discussion from the board? Hearing none, Madam Clerk, if you will, call the roll.
Commissioner Smith,
Yes.
Commissioner Liner,
Yes.
Commissioner McCabe,
Yes.
Commissioner Mitchell,
Yes.
Vice Chairman Booker,
Yes.
Chairman Jones.
Yes, thank you.
Thank you. Next pot of money for all of the things I spoke to earlier, $96,609. A lot of this is going, in addition to the contract staff, a lot of our staff are tasked with all of these efforts as well. So we have a lot of staff that are doing COVID most of the time and trying to keep up with their regular job as well. For instance, we had a UDS report that's required by the Federal Qualified Health Center every year, and it's due today. And all last week, we were running audits trying to get these things in order to submit them, be able to submit them by today. So, yeah, and the staff is doing an excellent job. We've gotten a whole lot of compliments from the community, and I'm very grateful that the hospital and CCHC and even Goshen Medical Center, their satellite, has been transferring doses as well. So the county, very supportive. The folks down at the convention center doing a great job, all coming together. And these are our first 2 pots of money for vaccine administration, really. So there's more to come, and I think that'll be coming from the feds to the state and then dispersed to each county.
All right, do I have a motion?
So moved.
Second.
I have a motion and a second. Any discussion? This is for $96,609. Madam Clerk, if you will, call the roll.
Commissioner Smith?
Yes.
Commissioner Liner?
Yes.
Commissioner McCabe?
Yes.
Commissioner Mitchell?
Yes.
Vice Chairman Booker?
Yes.
Chairman Jones?
Yes.
Thank you. In addition to what we've already talked about this morning, the COVID cases are coming down across the state. At one point in time, the 7-day average transmission per 100,000 people in the state was over 90, and now it's in the 30s. So it's about a third of what it once was. The state peak was somewhere around January 4th. And very similar here in Craven. As the state goes, we sort of go as well, so our cases are coming down. The last report I got from the communicable disease folks, Kathy Fisher at Craven, or at Carolina East, was that we had 23 Craven residents in the hospital here. That has been higher, still more than we want to see. And I think that our local rate is, we're in the 40s as far as transmission here. Some counties around us are in the 60s, some are lower. But you're beginning to see some dip below 20 in certain areas of the state. And that literally happens overnight. Their rates start to fall. So the hospitalizations in the eastern region have also fallen. At one time, they were over 500, 550 just for our region of the state. And now we're probably about 350 as far as in a region of the state, this northeast region. And the vaccine efforts got a lot of capacity. Really want to try to get more to our partners in the weeks to come, if at all possible.
All right, questions from the board?
I got one question. I'd like to thank Scott and his staff for doing wonderful work. I did get my second shot, and I had no affection behind it.
Okay.
None whatsoever. A little soreness, but it went away in a couple of days. And I also went to have my COVID-19 test on my nose and all.
Mm-hmm.
And I did it Thursday. Saturday, I got my results back. So it was negative. So I want to thank you, your staff, for what good work that you guys are doing. And one more thing, please. After the meeting, after you finish, could you hang around for a minute? The county manager and I want to speak to you for a minute.
Yes, sir.
Okay.
Yes, sir.
That's all, Mr. Chair.
Commissioner Smith.
My question has nothing to do with what you just spoke to. However, in the meeting that I attended earlier last week, there was the pastor that had hundreds of thousands of dollars. Is there a coordination there? I think he said they had like $300,000 grant. $500,000 grant. And I was trying to see how he mentioned giving tests. That was a lot of money in my view to give, just to be given the test. And I'm wondering, is he working with you in any way? I was trying to get a handle on what's happening there, and I know maybe that was my place to do that, but I'm trying to get some understanding of how that is working to help folk in Craven County, how it's working with the whole general scheme of things.
Yeah, in the meeting that we had with early or last week, that was the first that I'd heard as
Okay,
well.
I thought everybody kind of knew about it but me, because I was,
Not me either, but I know that they do have some transportation funds, you mentioned,
yes.
for people who might who might need transportation. And I do know that, like this past weekend, Carolina East had a large event, I believe, on Sunday at Day Spring Church, where they vaccinated a lot of
He worked with that.
individuals. I don't know if he was coordinated with that effort or not, but I do know that they're reaching out, and they have some point people at the hospital that are working with that. So as far as tapping into the resources or the grants for that church, there hadn't been a whole lot of coordination between us and them as of yet.
All right, other questions? Commissioner Mitchell.
Could you, the questions that I get, the phone calls that I get from people in my district are almost entirely about vaccine supplies that are coming into the county this week, next week, 3 weeks out. And you didn't get a whole lot of detail into that. And I understand that is a moving target, but could you, the second shot people I think are covered, but it's the first shot people who are the most concerned. Could you talk to us about what you're looking at the next 1, 2, 4 weeks out as much as you can?
Yes,
What's
ma'am.
going to be coming into the county?
We are on the third week of a 3-week baseline right now. So I'm hoping that this week we'll find out what we're getting for the next 3 weeks. Now, we hope. So what we have coming in is 500 baseline doses to the health department, and then another 200 equity doses. And the equity doses are for low-income, 65 and older population. So they ran our statistics for Craven County and ascertained that we had a little higher than average population of 65 and older that was low income. So they said, we're going to give you an extra 200 doses to go towards that effort. Now, the hospital, they're getting 400 first doses. So those doses I just mentioned, the 700 coming to us are first doses. Hospital's getting 400 first doses as well. And then we're getting all of the second doses. So, for instance, I believe this week we get 900 second doses, and I think the hospital probably got 1,950 second doses. So the body of work is ramping up, and we're hoping that we can get more first doses in our baseline allotments, but also the only other avenue you really have is to say you're having a special event to try to get, and that's not recurring really. What's happening on those is you submit for a special event, they may give you a one-shot deal of, and they want you to at least do 500 or more. So, and we're going to try to do a collaborative between the Carolina East CCHC and us to try to do a request for maybe an additional 3,000 and see if they'll give us any of that.
Okay, and I'm reading on the news that, CVS, Walgreens, Walmart pharmacies are at least in the chain somewhere in some states. Are any of our local pharmacies going to get any of those doses in the next few weeks?
Yes, ma'am. I believe actually this past Saturday, Walgreens had some.
Walgreens did Saturday and Sunday.
Yes, it did.
Yeah. And Relo has also applied to be a vaccine provider as well. And the vaccines, the reason in my understanding, the reason that like the CVS's and the Walgreens got it early was because they were the ones that had the federal contracts to do the rest homes and the long-term care. And evidently, people declined it. Maybe some of the people who worked in the rest homes did, decline. So they had this vaccine available, and they said, well, if we're not going to use it here, we're just going to move it over to our retail centers and give it to the general public.
But that's part of my question. It's one thing, we've got a supply here that didn't get used. We're going to move it over to Walgreens and y'all use it.
Mm-hmm.
That's different from, let's say, the federal government saying every week Walgreens gets $2,000, so every week Walgreens is going to be doing them on Saturday or Sunday. And I think what you're telling me is that's not happening yet.
Not that I'm aware of. I think what they're doing right now is clearing
They're using
shelves
up.
from stock that they had on hand.
Okay.
Yes, ma'am. And that's another issue we've heard with these so-called federal site setups across the country. I think that's another robbing Peter to pay Paul situation. So some of them are being declined now because there's no more. It's not like extra vaccine they're bringing with
Right.
them. I think they would just, and what's happened across this state, not just here in Craven County, is that the capacity and the infrastructure has ramped up. It's in place if we could just get more vaccine. But we're further along the line than it feels like to me. For instance, if you got 21,000 18-year and younger, less than 18 years of age in Craven County. Now, the Moderna product is not even recommended, I believe, for 16 and under. So we are right now right at 16,000 doses given, close to 12,000 first doses, okay? So if you've got roughly 80,000 people once you back out your 18 and under initially. They may get it later on, but you back them out right now. And then you say 60% of those 80,000 people want it. You're about 48,000 people, but you're at 12,000 first doses already. So in my mind, we may be, a fourth of the way there as far as getting the shots out to the people who actually want a shot. Now, I do believe the 65 and older population, you're seeing higher than 60% of them want it. But once you get past that population, we'll see. That's just an estimate based on some pretty good data that a lot of the places that have been offered it so far are really about 50-50.
Commissioner Lynham?
Yeah, Scott, you talked about the hospital 400. Now, are they splitting that with CCHC, or is CCHC getting 400 as well?
No, they're splitting that.
So they're only actually getting 200 each then?
They split it up like, I think the big event that they had at the church, I don't know how many they used for that. It could have been like 300 for that. So it's not assured that it's a 200 split, I think, every week. I think it's just basically what's going on that particular week.
So whatever number comes out of the hospital, that's also CCHC's share in that?
Yes, they usually slide some doses over to CCHC. And you can understand, they've got a great mechanism too. Both of them do for getting vaccine out. They could do a lot more. And that's, so it's turned to a situation where between second doses and first doses on our Tuesday through Friday clinic we're doing at the convention center, we're pretty busy with that because, we're getting around 400 doses a day now. That's a lot of people to move through down there in a day. But they could definitely use some more if we could get it to them.
Well, I got to say one thing. You got to be doing something right. We've got 2,700 doses we've given out to other counties, so people have come down here to get their shots. I mean, it's no fault of yours.
No.
I mean, we're good.
Now, 27, I've seen about 700.
I seen in the paper and on the news they said 2,700.
Okay, we ran a report and I think we had 700, just shy, about 697.
It's still, I mean, you get that many
Yeah.
people coming from Raleigh and
Well, you
coming
got
down here.
Carteret, Jones, Pamlico, Lenore, Pitt. Yes, sir.
Vice Chair Bucher?
Scott, a couple of things. Number one, I want to, being on your board, I just want to make sure everybody understands the magnitude of what this board is going through. Not this board, but this department. To do their normal work and yet add on all the work that's being done, the number of people taking calls, the people doing the call, contacting. They're putting in a lot of hours, and Scott, and mostly not Scott, mostly his people, are just doing a great job. And I just want to make sure that he and his people get credit for that. So thanks again, Scott, for that. The other thing I wanted to mention is, added to his workload, our governor, in his wisdom, decided to announce last week that now teachers are eligible. We are nowhere near taking care of our senior citizens who should get the priority, who are in a higher priority group. Now he's going to start getting phone calls and people going online from the teachers group. Whether we give them a shot or make them wait is his call, as I understand that, right? You have the option of continuing to go to the higher groups first before you go to the next lower group.
Yeah, effectively what was done with that last order from the governor's office was they moved teachers and daycare workers to the front of the line for group 3.
Right.
And we've had a lot of seniors say, hey, well, you know, what's going to happen? So, yeah, there's an opportunity in there. You know, I think the date was February 24th, and then on March the 10th, the rest of the essential workers. But it comes back to that lack of vaccine. I'm in total agreement. I'd love to see all of the essential workers and the school workers, and, you know, get it. But what's going to happen now is that yeah, you're right. The 65 and older are still Group 2, so they're still prioritized above. And what we've worked out with Dr. Doyle and the public schools here, Amy Heflin, I think it's a really good plan where they're going to have a portal, a registration portal set up to enroll in CVMS. The state's doing that for every school system, and I think they'll probably parlay over to large employers later on as well. But they get in there and register, and then we give them vaccine, and then their nurses go and vaccinate under our supervision. So they'll actually be taking it to the schools when we can get to that point.
That's good. I just found it frustrating that the governor has to be, I don't know if it's political or what, that he had to make that announcement when the vaccine's not available at this point to take care of that group. Why are we making this announcement? But that could be political. I don't know what his thinking was, or his health director, what her thinking was. Bottom line is, it just adds more people who think they're going to get moved up when there's not vaccine there today to take care of them.
Yes, sir. That's correct. You know, we're getting 1,100 first doses into the county, and that may change. We may get some new information where we're getting more. I hope we do, but yeah, there's not like a bolus or a special cache of vaccine meant for school employees right now.
And we're still getting calls and emails from seniors saying, I can't get in, what do I do? Frustration.
Yeah, highly
That's
frustrating.
still going on.
That's what 3 out of the, on Monday and Tuesday mornings, usually we make people happy in the call center. The rest of the week, they're not so happy because everybody after the appointments are gone. And people ask us about a wait list. We do not keep a wait list because we not feel it's practical to have thousands of people on a wait list, because what's occurring is our people, like we have people coming in from outside, our people are going to other counties as well. They're trying to go anywhere they can to get the shot initially. Once you have wait lists, it's a lot of work. It's a lot of work to give calls back and the phone not be answered because people think it's a solicitation call. People are calling back in wanting to know where they're at on the list. Thousands of people on a list. I think that the way we're doing it, the people are going to be frustrated any way you slice it because there's not enough vaccine right now. But it's very efficient, and once they do get in, it's a pretty smooth process.
Commissioner Smith.
Well, part of what I wanted to speak to has been addressed already. Again, I'm in the process, as you know, of trying to register people to take the vaccine.
Yes, ma'am.
And I'm learning that some of our seniors who could not get into Craven County went to Jones County or to Pitt County. So that is happening. The other question that I have is the question that they're asking me is which vaccine is available this time. They want to know whether it's the Pfizer or the Moderna. Do you?
It's the Moderna.
It's Moderna.
Yeah, us and Carolina East are both getting Moderna. For whatever reason, that's what the state's been able to get here in the last few weeks. If we're getting any Pfizer, it would be like a second dose Pfizer.
Okay.
But we're not getting, as far as first doses, it's all pretty much Moderna now.
Okay.
All right, any other questions? Not, Scott, we thank you again. Appreciate your time this morning.
Thank you for all your support. Much appreciated.
All right, next we have the Coastal Regional Airport presentations. We have with us this morning Mr. Andy Shorter and the chairman of the Airport Authority, Mr. Jerry Leahy. Good morning, gentlemen. And Mr. Cushman, the attorney. Welcome.
Thank you, sir.
Thank you all for waiting this morning. Sorry it's been a little long.
No, that's quite all right, sir. Good morning, everyone. Nice to see you. Hope everyone had a nice wet weekend. Tough act to follow on that last one, but I'll try to do my best, and I appreciate your time this morning. The first thing I'm going to start off with is a brief about the Small Community Air Service Development Grant Program, or Program Grant. It's a tongue twister of a acronym, but like all good federal programs, it has one, and so we call it the SCADSI. Next slide. First, however, I want to start off with updating our economic impact numbers. So the state in January released a new report based on 2019 numbers. So these were pre-COVID numbers. And you'll see that I superimposed them onto what our 2017 numbers were, so you can kind of roughly do the percentages in your mind. But it's about a 25% increase. So the big foot stomping number there is Coastal Carolina Regional Airport has about a $500 million annual economic impact. So that's direct, indirect, and induced. And below that, you can see how the jobs and then the tax revenue and the personal income break out. So almost $100 million in personal income and up to $16.6 million in state and local taxes that are incurred through the activity at the airport. So that's a pretty good number. The state overall has gone up to $61 billion for all 72 airports in the state, and that's about 10% of the state's GDP. So again, we like to use the term airports mean business, and this is a good indicator of how that's true. So with that, next slide. These are the 5 bullets of the program. There you can see the SCADSI acronym, and the Small Community Air Service Development Program is the name of it. I'll talk about the grant uses, the program funding, the elements of a successful grant constraint. So I just want to give you the broad brush nature of what this program is. It was kind of a short fuse. We were not planning on doing it this year initially, but late last month, we were told that the FAA extended the deadline for the grant this year to March 1st, which was important enough. It's something that they normally don't do. But then the other more important factor, they more than doubled the amount of money available for this grant this year. So it was one of those situations where it was, maybe riskier not to try it than it was to try it. So we pulled a pretty quick trigger on this, and hopefully, actually, maybe some of you have heard about it. We just sent out put out a fishing line, put out an email, and people caught on to it. And we just, the first weekend, we sent it out on our Friday, had a lot of support. So we were very encouraged by that. So we decided to, kind of day by day evaluating how it was going, and decided to keep going with it up to this point. Next slide, please. So the SCADSI grant is only, or one of 2 grants available to small rural communities. The other one, Central Air Service grant, does not apply to this community, but the SCADSI does. And we indeed had intended to do a SCADSI grant next year, which would be for 2023 service. I'd already been talking to United Airlines in the last couple years, and they are, or had intended, and I believe they still are intending, to have Dulles turn into, for them, that Charlotte is for Americans. So to be kind of a southeast regional hub for them to do regional service. The SCADSI is an annual competitive grant process open to communities with small airports not larger than a small hub. Our airport is considered a non-hub. Wilmington is a small hub. Asheville is a small hub, just to give you some indication of size there. And it's to provide temporary financial assistance. So this isn't the be-all, end-all. This is what's really used to get service started at small airports in regional communities, or help service grow in small airports, regional communities. Next slide. And these are some of the statutory limitations, just for your information. Usually about a max of 40 grants each year, and no more than 4 to the same state. Now, this will be interesting this year because they've kind of expanded the program, whether they expand that statutory clause at all. And then generally the priorities that we'll see on another slide, but here it talks about higher than average fares. That is probably used less that way than it is to create additional service at locations, but it consists of a local cash contribution. It's an established public-private partnership. So like all our federal grants, there's a local match required, but this really is graded on how much local support you have, public-private, for partnerships. And it material benefits a broad section of the community, from business down through education. And they want to make sure you can ensure the timely use of the funding. And that's really why we were targeting 2023 before, because not only do you need the grant to get the money on the one hand, you need to have someone to receive it on the other hand, and that's what they're talking about in that bullet. And we had kind of felt out united that they weren't going to be ready till 2023. However, now we know there's another carrier that's does network service, so it's a small regional carrier that flies the larger airlines' flags a lot of the times, but they also do some of their own work. It's called at risk because that's what it is. It's not tied to any large carrier initially, but they are interested right now. So we do have someone that's receptive on the other side of this as well. Next slide. So these are the 5 bullets of the common uses. Air carrier revenue guarantees. So that's basically what we're looking at. What that is, carrier decides to come into a community. It's done the market research. Carriers won't just come willy-nilly anymore. The banks in the last 10 years have been very strict with the airlines about managing their business model, staying off the roller coaster and just having a good, steady increase for their business over any given period. So what the revenue guarantee does, it helps the airline reduce their risk of starting new service into a new location. So it goes in and says it needs to sell this many tickets at this amount of price in order for it to be profitable. And that's what they are. They're a profit demand organization now. They've gone away from market demand. They've gone to pure profit demand. So if they are not, they come in, say, month 1, and they get 50% of what they projected that they would get. Well, then this grant would then backfill that other 50%. And so hopefully it would obviously wean itself out over time. We had one of these revenue guarantees when Delta came in 2008, but it was so strong and the market research was so good that they never had to spend one dime of a revenue guarantee when Delta came in. So while this money is put up, oftentimes it's not used or executed. Marketing, we can help with general route specific. Again, airlines are very interested in that. When they start a new route, they want to have a good amount of marketing out there. Aircraft upgrade would relate to upgauging of aircraft, so larger aircraft on a similar route. Also, you can use it for research studies. Leakage study, that's what we call somebody that lives in this area that drives 1, 2, 3 hours to another airport to use it. And studying the catchment area or any intermodal models, which really don't apply to us. That would be trains and planes kind of things. And then to offset startup costs. Again, big capital costs in the airline industry, and so that would be one of them, the ground servicing equipment, things like that. Next slide. So what is it? Project funding. It's a reimbursable grant program like I just talked about. The community's front payment. So that is just like our other airport improvement program grants. We essentially get the bills in, we pay out the money out of our accounts receivable, out of our fund account, and then we apply for the federal money that pays us back for 90% of those improvement program grants. So this, we would pay ourselves back with whatever percentage the grant worked out to be plus the public pledge piece of it. There's no limit to the individual grant awards. However, funding requests should be reasonable given the totals available. And this, like I talked about before, 18 million is available this year. Last year was a little over 7 million. So again, they more than doubled the amount available this year. And then normally grants can be given as low as 20,000 up to $1.5 million or so. And I think what we're aiming at in this grant would be $1 million grant. Okay, so the next slide just kind of goes over those priorities again. If you work left or right and talks about the points or shows you, indicates how we work through the process. Next slide. Now see, these are some of the secondary considerations. Again, creative solutions, including regional ideas. Some airports have used these, which wouldn't be out of the realm here, to daisy chain an airplane. That's something that's generally not done anymore, you know, where you get on a plane and then you land somewhere else, but you stay on the plane and then you finally go to your hub. But it's been done successfully down in Mississippi in the last few years, and that would be one thing that we would talk to airlines about to see if they'd be interested in this kind of very unusual situation.
Andy, let me make sure I
Yes,
understand
ma'am.
what you're saying. Let's pretend an airplane takes off from Newbern, and it with 10 passengers, and it lands at Greenville and takes on 5 more passengers, and then it goes to Dulles. Is that what you mean by daisy chain?
Correct.
Okay.
Correct. And actually, that's something that we've already pitched to Delta to get them back here, to do something like that, where they would start here, I'd say go to Wilmington, probably fill up the rest of it, so they could upgauge the plane one size to meet the needs of both stations. So again, these talk about the broad support, which is again the foot stomper, and that's what the federal government wants to see. Something I didn't mention up front, this is a DOT program. It's not specifically an FAA program, but a DOT program. That's why you see some of the intermodal things, other modes, they'll have like grant processes. Next slide. So here's the successful application, no set format. We have an air service development consultant. He's done this for 20 years. He knows what this looks like. They, as a firm, are very successful of getting these grants. So we're putting together the application, of course, with their help. Description of service and needs or deficiencies, which, of course, we have a great description of that now, that especially with Delta being suspended, it would be a almost in-kind restart of a similar service that we've proven that we can already have and maintain. And we actually have some good indication numbers of that northbound route as well. And that would be good for this area because, of course, PGV, ourselves, and OAJ have been kind of beating the same drum for a long time, Charlotte, and then with the Delta, the Atlanta service. So something going north would be well served in this area. So that goes into the strategic plan of meeting those needs, a detailed description of necessary funding, and an explanation of how the proposed project differs from any previous grants. Well, we hadn't done one of these in ever, so we have a clean slate here. A lot of airports get these and have them on the books, and it goes back to using the funding, and they don't have the receiver on the other side, so they do not have good track record. So I think we sit very well for that. And then designated a legal sponsor for administering the proposed project. And again, we have a good track record of doing that with the Airport Improvement Program grants, so I don't think any of that would be a hurdle for us. Next slide. A couple of the constraints the department assesses the community is ready to implement. This would be more applied to a community that doesn't already have air service, but we do. We're experienced with it more than 50 years. We've had commercial air service. And if there's some airport improvements needed, for the size of the jet we're talking about, we don't need any airport improvements. Our runway is sufficient for what they would be using for this route. And then late applications are not accepted. So again, kind of the 3-alarm fire with us getting this done here in about a month's time. And then if we do have difficulties, there's a potential window to correct the application. And the grants are not awarded or announced until May, so there's a little bit of a delay in there. So finally, the last slide. And I have a full paper copy of this that I'll leave with Ms. Holton and also the new economic impact statement that you can look at this. But this is an excerpt. Again, we have really been hitting the ground running here. And ITRI at NC State, they work with the state DOT a lot and do a lot of research things. So they've already done a report on the economic impact of this route with 2 flights a day, 365 days a year. You can see up there, that's another $21.9 million a year economic impact. So likewise, if you think of our 2 Delta flights a year or a day for a year, that's probably a loss right now of what we don't have without Delta being here. We have seen some indications recently. Just last week, we got some data that, in my mind, if I were to speculate, I would say that Delta's probably close to or has already made the decision to eliminate EWM from their route structure. So they haven't told us yet. The answer to us is still, we don't know. And as far as network planning, they're not talking to us. So once again, a new service coming right in on the heels of that, I think would do very well. And we have the proven data to show that that Northeast area is a hot area for us. We've already briefed that to American. Of course, we've sent it on a brief to Delta. But we have very good data and very good assessment of what that would do for this area reflected in these impact numbers.
All right, thank you. Any questions from the board? All right, then the next item would be the airport acquisition.
Yes, sir. I think if you look in your packets, 5A, something like that, you'll see the diagrams there. The church property, this is a little bit of an add-on. We talked about the 2 residential properties a couple months, or maybe a month, 6 weeks ago. This one, we took a pause on it. We had some more internal discussions about it because it's kind of a twofold. While we would normally, or we will consider it to be a anti-encroachment issue, certainly along the front area of the airport, it's going to be non-aeronautical. You can't get airplanes or taxiways out where we're talking about. But the encroachment would be, as they continue the construction on I-42 and displaced businesses, we believe that some of those businesses are going to try to relocate. So what we're trying to be protective of is our property out front, that we don't get blocked in somehow by some business that would not be a good partner with the airport. So the Generation Baptist Church, a few years ago, they came to us and asked about maybe buying the property, and it was not right at that time. So since then, we've gone back to them, and they are interested in this back. It's, Charles, 1.28 acres, undeveloped on their church property that's adjacent to current airport property. That here, and then here's the next piece of it, property that we are considering as potential non-aeronautical commercial use. So we've had a meeting with the manager and the county attorney, and then since then with our 2 commissioners that are members of the airport authority. And so we're talking through that. We're still 5 or 6 steps away from understanding, using it for commercial purposes within the airport, what we call the airport city, things that you would normally see around an airport. Gas stations, convenience stores, quick service restaurants, and up to and including, hotels are some of the things that you see. And those first 2 categories are things that are being displaced off the Highway 42, right away land grab that's going on right now. And ultimately, the gas station is very important to the airport because of the rental car service. We have 6 rental car companies that obviously use those gas stations certainly daily. Anyway, so the proposition here is to go ahead and purchase that land. It's been evaluated at $167,000. We're still have yet to do a environmental due diligence study on it, but everything looks set to go. When we were having the discussion with the county manager and the attorney, it did come up. Well, how about the whole property again? So we've gone back to the pastor, and they're thinking about it. So they want to go ahead and move on with this part of it, and then we're going to go ahead and get the rest of the property appraised. he said that if it did come out good and they agreed to it, of course, he'd like it leased back to him for at least a year so he could find other property. I think in his mind, they would like to move further south or further towards Havelock or anyway. So anyway, it's a very cooperative engagement with the Reverend, and we appreciate his partnership. And so, again, today the proposal is to buy the 1.28 acres, which of course is FAA reimbursable either through the CARES Act money or the normal AIP process. So either 100% reimbursable or, worst case, 90% reimbursable.
All right, before we take a motion, do I have any questions?
Mr. Chair, I have a question here. I've been in before a few years ago with me and Johnny Sampson, and here said the owner has expressed interest in selling the property. He's the owner, just him, or is our congregation?
Well, he has a board, but he's obviously cleared it with his board or congregation, however his advisors.
It is in writing that he cleared with the members.
Yes. I mean, the legal documents will be that whatever the church is incorporated on will be the whoever is titled to. So it won't be an individual.
Correct. The titled owner of the property are the trustees of Generation Baptist Church, and Pastor Heyman has been our contact throughout the conversation.
So everybody agree to sell
Yes.
property?
Correct.
If we got to the point where there was a deed being signed, then the trustees would be the ones signing the deed. So.
Okay.
All right.
Thank you, Mr. Chair.
Any other questions?
I want to make sure I understand. We're talking about buying this parcel right now with reimbursable funds, or
Yes,
with
ma'am.
funds that will be reimbursed to us, but we may buy a second piece?
Correct. We are moving forward with the appraisal of that second piece
Okay.
of it.
So right now, we're going to buy part one, and we may end up buying part two,
Correct.
depending on what the church wants to do and we want to do and whatever. So,
Right.
okay, got it.
All right, any other questions? Hearing none, do I have a motion?
So moved.
Second.
I have a motion and a second. Any further discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion passed.
Right. Thank you.
All right, I got a question here. Yes, sir, Vice Chair Booker.
Want me to go first?
Do what? Go ahead.
A year ago, before we were hit by the pandemic, we had Delta and American flying 10 flights a day in and out, roughly, I don't know, whatever. What's the number today as far as passenger count compared to what it was a year ago with those 10 flights versus whatever we're getting today? How big of a drop-off? I know we had a big drop-off.
Yes, sir.
Where are we right now?
So, start at the end with that. So, calendar year 2020 ended up at a 38% recovery. So, 62%, is that right? Is that math in public? Drop for the average of 2020. So that's all the way down with that, 96% drop and then back up. Right now, today, we were at about a 48% recovery. So just below 50% for the last couple months. That's where we're riding. The good piece of that, it's horrible to only have 48% of your business, but the good piece of that is we're about 10% ahead of the national average, which is still hovering around that 38% mark.
Thank you.
And what that equates to right now, and January and February is a slow month, really across the nation, and it's usually helped out by the business traffic, which is the biggest loss that we've had so far, and that affects our parking lot. So even though we're almost 50% of our passengers, we're less than that as far as our revenue in the parking lot, which is our biggest generator. So we're hoping, again, the summer, things opening up. That's what we're pitching to the airlines is this is a destination. Carteret had a banner year last year with rentals and things. So we've passed that to the airlines, and they're very appreciative. Both airlines have just recently announced new routes, and they're all to locations: Myrtle Beach, Key West, Daytona Beach, Traverse City, Michigan, which I didn't know that was a big thing, but apparently that's a good place to go now. But they're all these destination places. So we're trying to, kind of flip the script here a little bit and really pitch ourselves as one of these wide open destinations.
Thank you. Mr. Leahy, you want to come forward just a minute, introduce yourself, have the opportunity to speak just a minute. Carry him right here to the podium where
Take his mask off.
they can hear
See what he
you.
looks like.
As I refer to him, I call him Roseanne's husband. So
I am that, guilty. Joe Leahy, I've been on the airport board now for a little over 9 years. Enjoy it immensely. My career was in airport management, so it's been fun. And I appreciate y'all's help in what we do.
we appreciate your leadership.
As far as the small airport grant is concerned, I'm very bullish. As air service, I've always felt if there's a market, there's somebody out there that'll serve it.
Gotcha. All right, any other questions?
Thank you.
Not, thank you all, gentlemen. Appreciate you being here this morning.
Thank you.
Board, we're going to cover the sheriff's items, and then we're going to take a recess. But I feel like we need to go ahead and let them come on in so they can go about their activities for today. So, Sheriff, welcome. And I think we have with us Major David McFadden also. I think he may make the first presentation. Come on up for the vehicle lease. Good morning, gentlemen.
Thank you. Good morning. I'm appearing this morning to request the approval of a lease for a vehicle for the Sheriff's Office. The lease is contained in Attachment 6A. As noted, the lease was prepared by the county attorney. We have a number of reserve deputy sheriffs at the Sheriff's Office. Generally, they are retired officers. They are fully state certified officers who must maintain their state certification and training. We utilize them when we can as extra personnel. We would like to use them as patrol deputies. However, due to a shortage of patrol vehicles, we have been unable to do so. We just don't have spare vehicles. One of our reserve deputies, a local businessman, many of you may know, Mr. Ebby Howard, who has been a friend of law enforcement for years, has acquired a police-rated Chevrolet Tahoe, late model Tahoe, fully equipped, and he has agreed to provide it to the Sheriff's Office for use. We discussed how that might be done and agreed that a lease situation would be advantageous to the Sheriff's Office and to the taxpayers of Craven County. As I mentioned, Mr. Howard has been a friend of law enforcement into the county for many years. He operates a body shop here. And in the lease, you'll see he has agreed to provide maintenance for the vehicle at no cost to the county, be responsible for its maintenance, and also indemnify the county for the use of that vehicle. Those provisions are contained in the lease. The vehicle would be used at the direction of the Sheriff's Office for Sheriff's Office's purposes only. It could only be used for law enforcement purposes. The lease also is counselable by either party with short written notice. Leasing vehicles for law enforcement use is actually a fairly common practice. I think New Bern Police Department leases some vehicles. Obviously, this is somewhat unique in that we're not leasing it from a corporation, we're leasing it from an individual. However, the advantage is the cost of maintaining this vehicle will not be borne by the taxpayers, will be borne by Mr. Howard. So we would ask that the Commission approve the use of this vehicle through a lease and provide an additional vehicle so that we can better utilize our reserve deputies. And I'll be happy to answer any questions.
All right, questions from the board?
I want to make sure I understand. The owner is responsible for maintaining the vehicle.
Those provisions are in the contained in paragraphs in the lease.
Well, that's what I want to make sure. So it's not, this does not fall under the sheriff's vehicle maintenance program under county services as will be provided.
That's correct. I don't have a copy of the lease in front of me.
I do, but I want to clarify.
Yes, ma'am. Yeah, that is absolutely the agreement. We explained that to Mr. Howard. He is as I said, he's been a friend to law enforcement and actually saves the county money every year through being able to be cooperative with us and assist us when he's needed. He became a reserve deputy, certified law enforcement officer, but saw that he would not be able to be a patrol officer. Now, he has gone through the field training officer program and is ready to work. So he, on his own, was willing to purchase this vehicle for our use, understanding the requirements that are placed on him and the responsibilities.
Well, I know, and I understand the indemnity purpose of it, but indemnifying the county does not mean somebody cannot sue.
Well, that's absolutely correct. And of course, as with he and any other reserve deputy, or any other deputy for that matter, the county would always be sued. But the benefit regarding this particular vehicle is that he has agreed to indemnify the county and maintain an insurance policy. And I think those details, I know those details are contained in the lease.
Yes, they are, and I voice my concern.
Yes.
Commissioner Liner?